My name is Nadia. I'm a comedian, writer and actor originally from Swansea. And now I'm training to be a doctor in the NHS. As a half Welsh, half Iraqi person who's moved around a bit, the NHS has always had a special significance to me. It gives me a sense of belonging and of safety, of home. Actually, when I lived in the US and I didn't have that sense of stability that the NHS provides, it made me genuinely anxious. It means so much to me that I've chosen to swap the glamour of Hollywood for a public service career on this tea-sodden island. On July 5th, 1948, Aneurin Bevan launched the National Health Service at Park Hospital in Manchester. 70 years on, it's hard to imagine the UK without the NHS. It's at the heart of who we are, and its origin is undeniably Welsh. Before the NHS even existed, something remarkably close to it was happening here in Bevan's hometown, Tredegar. This is where the idea of universal healthcare took root and was developed, a sort of test tube for what the NHS would become. The good people of Tredegar succeeded in creating a medical service for themselves, the Tredegar Workmen's Medical Aid Society. This building on Church Street is just one of their early achievements, Tredegar's Central Surgery, which was built in 1911 and then became an NHS facility when the service launched 70 years ago. Doctors, dentists, nurses and a pharmacy were all available under one roof. After closing in 1980 and falling into disrepair, the building is being refurbished now as a care home. But there are plenty of people in the community who remember what it used to be like.
I can almost see it now. It was Dr. Daly's room, was outside. There were seats facing her for about 3 rows of seats.
Everybody was seen, weren't they? Everybody who walked in through the door was seen.
Yes, they were, and they were...
There was no appointments, everybody just walked in and took a seat, and everyone was seen.
And everything was here. We had a brilliant pharmacist then. His name was David Jones, but we knew him as Darty the Pell. I rang him. He was absolutely brilliant.
So this was a real core part of the community.
It was, but it was about people not suffering, meeting the demands, there at the point of need.
And how healthy do you think that idea is now? Do you think it's still as important?
I think the idea is still as important. The philosophy is there. It should be free healthcare to everybody. Everybody. And I mean, we were used to that. My father paid the medical aid. That's what the NHS
before the NHS.
And my father loved Aneurin Bevan, absolutely loved him. He was a god to the people around here. And my father went to his funeral, as did most of Tredegar. And my mother said he cried for a week after him. He was held so much in high respect.
Aneurin Bevan's mission to Tredegarise, as he put it, the whole of Britain, was met with huge resistance. The greatest resistance came from the medical profession itself. Doctors hated the idea. Doctors had it great, privileged, rich, completely independent. The idea of becoming government employees, running a crazy socialist experiment for a radical, swaggering Welsh health minister? Absolutely not. And that'll be £50 for the consultation. Please get out of my house, which is also my practice. That doctors are now some of the staunchest defenders of the NHS and the principles that underpin it shows how successful that original idea has been. Right now, it feels like the NHS is under attack again. Maybe we should charge for doctor's appointments. Maybe we should move to an insurance-based model. Maybe we shouldn't treat certain people. Patients in Wales come to the NHS with their various complaints, coughs and carbuncles 20 million times a year, and their support for it is unwavering. The NHS today is facing real challenges, but they are nothing, trifling challenges compared to what we were facing in 1948. You couldn't even get a banana, for goodness sake, bendy or straight. But they managed to establish a universal healthcare system even without the quick-release energy that bananas provide. The fundamental idea of the National Health Service is as solid today as it was 70 years ago. But if it's going to last another 70 years, we are going to have to look after it. And despite the fact that it involves looking at way more bum holes than I could have ever anticipated, I am ready to do my bit.